Hello. Good afternoon, everyone. As advertised yesterday, we're here to talk about hypertension, the silent killer. And with me here today is Dr. Folasade Alli. My name is Dr. Olaolu Adewale. I'm a care coordinator with Avon HMO. So before we get straight into it, I'd like to just a brief introduction to talk about Dr. Ali. She's a consultant cardiologist, cardiovascular researcher, and board certified attending adult cardiologist. She's got over 30 years of experience with a career devoted to the diagnosis and treatment of heart, vascular, and thoracic diseases through early detection, education, and prevention, primarily in Nigeria. She currently serves as the medical director and the chief of cardiology at the Lagos Executive Cardiovascular Center, LECC for short. And our expertise includes heart failure and heart attack case management, cardiac asthma, acute coronary syndrome and coronary artery disease management, chest pain management, hypertension, diabetes, and thyroid disorder case management, arrhythmias, as well as stroke case management. So with that brief introduction, I think we can get straight to it. So Dr. Ali, we're talking about hypertension. Okay, it's quite common. And I know it's something that I'd say all doctors in Nigeria will come across one way or another at primary, secondary, or tertiary level. So my first question is this. Just a brief introduction about what hypertension is.
Okay, good morning, Dr. Adewale. Hypertension simply means elevation of blood pressure with regards to the heart, pumping blood into the blood vessels. It means there's a systolic elevation when the heart pumps blood into the vessel. That force of pumping is elevated, and then when the heart relaxes to be filled with blood, that the pressure that is left in the blood vessel, while the heart is relaxing and refilling, that is that tension is what we call the diastolic blood pressure. So hypertension simply means the tension, the pressure in the blood vessels with regards to the heart pumping and relaxing, pumping out its blood content and relaxing to be filled with blood. That pressure, that pressure interface between the heart and its vascular branches is what we call, when that pressure is elevated, is what we call hypertension, when it's above what is supposed to be.
Thank you, Dr. Ali. I guess my follow-up question is, what is the normal blood pressure? And when can you say an individual has got hypertension?
Well, normal blood pressure, really, it tends to be a range, because in human beings generally, things are, you cannot say definite, so it's always a range. And that range, that convenient range, is systole, that pressure by which the heart pumps blood into the vessel. That pressure, we tend to say between 90 and 130. And then when the heart, is feeling relaxing, filling, with blood, to take in more blood, that diastolic phase is in between 60 and 80 maximum. So that's systole 90 to 130, diastole 60 to 80 millimeters of mercury.
All right. So anything above that, would we call that hypertension?
Definitely. Anything above that is hypertension. And in those days, we used to have a term called prehypertension. Prehypertension, whereby in the range of systole, in the range of over 120, that's 121, 122, 123 to 130, and diastole in the range of 70, 79, 8, then you say looking out for, say watch out. By the time your diastole is 79, we say watch out.
Okay. Okay. Okay, Dr. Ali, just to clarify for our viewers that are not in the medical profession, the systolic pressure is the upper value, the
Yes.
diastolic is the lower one.
Wow. Yes.
Okay, so when they go and have their blood pressure checked, the upper value represents between what Dr. Ali just said, not above 130.
Not above 130.
And the lower one, 60 to 80.
Yes, not above.
Okay, okay, all right. So Dr. Ali, my second question is this. Are there different types of hypertension? I mean, we hear hypertension. Are there different types?
What we mean by saying different type of hypertension, meaning yes, there are two types, two major types, based on what we think might be the cause. The first one is a primary hypertension, which we don't know. It's of a known, no known cause. But it's believed that there is a genetic undertone, there is an inheritance to it, there is a no known cause. There is age as to age, your sex, as a male or female. And then your race, as in maybe black or African. Hello, hello.
Yeah, we can hear and see you, Dr. Ali. Yeah, we can.
Yes. Okay, so we have the primary one, which we don't know the cause, is of unknown cause, but heredity, genetic, age, race, those are the causes of, that be, associated with that one. And then we have the secondary causes of hypertension, whereby there is an underlying problem, maybe thyroid disorder, possibly even use of drugs in management of other condition, or drugs that we use, even your common cold drug, decongestant, cough mixtures that contain phenylephrine, and if somebody become hooked onto it, continuously, the person might be liable. So we have conditions like Cushing's disease, adrenal problems, and the likes. So those are, and or kidney diseases. Kidney diseases from even infection of the kidney, chronic infection of chronic glomerulonephritis, or other diseases, or other conditions that can, affect the kidneys, or so we have secondary causes of hypertension. So we have hypertension as a result of those organ problems or drug intake.
Okay, but Dr. Ali, thank you for that. But based on your experience, which one would you say is more commonly found, especially in Nigeria? What would be in your experience? Is it more the primary or the secondary hypertension?
Of more common is the primary hypertension. It's commoner than the secondary ones. Although we can say that sometimes these things are interfacing, whereby hypertension starts off primarily, as a primary hypertension, and then there's a secondary end organ dysfunction, at the end of the trail. So it's like everything now combining together, starting off at the primary hypertension and then ending up with secondary organ, organ damage, whereby so that's that vicious cycle. But primarily, more common is the primary hypertension. Yeah. Primary hypertension is
All right. Okay, thank you for that, Dr. Ali. Just to highlight, something I think we've noticed here in Nigeria is that growing up back then in medical school, what we realized that hypertension was more commonly found in older individuals, people in their late 40s and upwards. But I think the trend now has changed. We're seeing young men and women, some even in their 20s, who have high blood pressure. What would you say is probably responsible for this?
That's a very nice question, I must confess, doctor. And it's also baffled us, as cardiologists, as scientists, that everything is changing. Everything is changing. When we were in school, the teaching was, blood pressure elevation. You look for it around the age of 40 and above. But now, interestingly, you have high blood pressure, really very bad ones, even with end organ damage, at a much younger age group, or rather, quite a number of them are much younger, working, adults, under, students coming down with high blood pressure. Yes, just as many things have changed, so also our lifestyle have changed. We have said that majority of the common causes of high blood pressure is heredity, unknown cause, genetics, and we don't know. But it has been well known that our lifestyle, what we call environmental factors, contribute largely. Environmental factors, lifestyle, the environment we are exposed to, our lifestyle especially, contribute largely to development of high blood pressure. And you and I know that back in those days, when we are students, we're just, all we do is just go to your cafeteria, eat your food, gently you go to your, or back to your hostel, to Queen's Hall. In those days, we go back to our reading rooms. Life was simple. We're more into. But now, it's a different scenario in the universities, in our young adults nowadays, and you see them chasing after so many things. Habits that they have picked up, westernized habits, Western diet, Western habits, smoking, excessive drinking of alcohol, the use of all form of drugs, cocaine, weeds, and they even boast of some mixtures to initiate you into the university. You understand? So all these things, they might not know, that is contributing to their ill health. They might not know. They will just think, oh, they're just belonging. Peer pressure, peer pressure. The lot of peer pressure is so much nowadays, such that they want to belong, and chasing many things, stressing themselves, and so on and so forth. So many things have changed, and therefore, what our fathers used to experience much later in their own age group, we're seeing it in much younger age group. So because of our environmental factor, and of course, we shouldn't forget even what we live now. During the pandemic, there was a group of researchers that studied environmental pollution in Asia, in Europe, in America, while every one of us were locked in our various houses. And they found that the purification of air was 100% over Asia, over Europe, over America, 100% purified air. And as soon as the pandemic eased off a bit, and they went back again, they sampled the air in Asia. Of course, it has become, impure, as much as, gone down to like 40% in just within few weeks of the society. So what we breathe in, the air we breathe in, the water we drink, the food we purchase to eat, the quantity of fertilizer in all these things, they are part of what is causing inflammation. High blood pressure, comes, to be when the pliable, once very pliable blood vessels, soft, subtle, nice looking blood vessels that gently undulates up and down, becomes, start stiffening up. The vessels they begin to become like lead pipes, such that their gentility of undulating gentility of on and up and about is no longer available, and the heart is now pumping into a resistant pipe. So, and what contributes to this inflammation? What we drink, even the air we breathe in, so much pollution from generators, cars that are smoking joes. You and I might not know, but these are what is contributing to what we have. to our total being, to our total existence. So it's quite a huge problem, and it's a global thing. It's not only in Nigeria, it's not only in Sub-Saharan Africa, it's a global problem. And WHO is well aware of this. And that's why you keep hearing people, climate change, greenhouse, do this, do that, less production of this, more of that, just trying to create an enabling environment for every one of us so that we can live healthier. Because if, for example, as young as 20, somebody already have a blood pressure of 180 over 120, and that person is supposed to live up to 70, you understand? How do you do it? So we need to begin to talk about our environment. We need to be very sensitive. Now we are waging a war against what we don't see. COVID-19 is the same thing. Yes, COVID-19 is a war of what we don't see. It's the same thing as we're talking about even today. There are so many things that we don't see that are affecting our health. But they are there, and we need to be cognizant of them and way to manage.
Okay, all right, Dr. Ali, that was a very good explanation. Thank you for that. Before I talk about the next question, our attendees, if I'm sure you're all enjoying this session, if you have questions, kindly type them in the text box, and Dr. Ali will answer the questions at the end of the session. Now, Dr. Ali, what you mentioned now actually answered some of my questions. I was going to talk about not exactly causes, but more risk factors. You already spoke about, I would classically classify them as modifiable and non-modifiable, yes. But I think you've dealt with both already in the two questions you answered. So I'll move to the next one, which is, what are the problems that we sometimes see in patients that have hypertension, or in a more clinical way, complications of hypertension?
Oh, okay. Complications of hypertension, they are very numerous, and we can have, the most important one, is the formation of what we call atherosclerosis. Atherosclerosis. Atherosclerosis is an inflammatory, base, because now we know now that the pathogenetic basis of disease entity, majority of diseases that human being suffers from is inflammation. It's inflammation. The undulating, the shear stress of high pressure on the wall of blood vessels, creating some form of what we call separation in the wall, and in those points of separation, deposition of fats, deposition of lipids, deposition of all kinds of immunologic cells, and subsequent atherosclerosis of those vessels. So that is a well-known entity, and of course from there you have kidney disease, hypertensive kidney disease. You have the hypertensive retinopathy. You have the almost blindness. You have the coronary heart disease. So the baseline is that atheromatous plaque formation, and you have, of course, the stroke event as well, because the blood vessels is the blood vessels from the brain right to the toes, isn't it? So you have peripheral artery disease, and then even you have the problem with impotence, what we call poor libido in men. It is still this atherosclerosis. So, and then going on even to sleep apnea, inability to sleep properly, is also faced with complications of hypertension. So the complications are quite heart failure, and heart enlargement, hypertrophy of the heart. In fact, the cardiac one is so numerous, including ischemic heart disease, coronary heart disease, and including sudden death, unwarranted death, what we call preventable death. Because the good thing about high blood pressure is that it can be well managed for years, such that the individual does not have to die from all these complications I've mentioned. They don't have to die from all these complications mentioned. They don't have to, if the blood pressure is early detected, the elevated pressure, early detection is key before end organ damages begin to rear up its end.
Oh, Dr. Ali, thank you very much for that. That actually fits into my next question. The theme of today is the silent killer. So, I mean, we all know that hypertension is called a silent killer because there really isn't any particular or definite sign or symptom. But can I ask you, is there anything that regular individuals can look out for? Or is there any measure they can take to sort of identify or prevent hypertension?
That's good, doctor. That is why we're here, to educate every one of us. What can you do? What can you look out for? I mean, what must you look out for? You don't used to have headaches before, and you begin to have some headaches, then you should know that you should do something. You shouldn't just take Panadol and start walking away. I know the Panadol people said take Panadol for 3 days and then consult your doctor after that. You know, I wouldn't want even you to take it for three days, because the more your pressure is continuously elevated, the more the blood vessels are being jeopardized. So therefore, if you begin to have experience symptoms that you don't experience before, even when you find out that you don't sleep well, you suddenly wake up in the night, you can't sleep well. It's not as if you are thinking of your container on the high sea, but you just find out that sleep is not coming. It could be underlying high blood pressure that is not attended to, that you don't even know that is there. So when you find some changes in your system, then you should do something. You should shout out to the doctor and say, look, this is what is happening. Don't keep it to yourself. Some people can have nosebleed. Nose bleeding is one good. Another one. Some ugly chest pain that you don't have before, or some tiredness that just come on. You are the one that easily run up the head stairs without feeling fatigue, and now you just run up 2 flights of stairs and you start breathing and panting. You should know that something is wrong somewhere. You need to look out for what this could be. So and your heart beating, palpitating, or faster heartbeat, then you know that you need to find out, why is my heart under this form of stress and palpitating away. So these are few, some of kind of signs, or rather some symptoms that individual can experience, that will make you to say, okay, let me even visit the hospital, let me check my blood pressure, let me even see what my blood pressure is talking about. Although somebody can have a blood pressure of 180 over 120 and be at its very best without any symptom. Albeit, yes, as you grow older, so we now advocate that youngsters, university undergraduates, people who are young, adults, working force, working populace, they should take more care. They should take more care about themselves. Be conscious. Be proactive about what is happening to you within you. Be proactive and do something. Do not leave it late. Don't postpone it. It's your health. Your health is your wealth. You can stand up, and do. We can stand up and do what we are doing today because we believe, we are in good health. So therefore, when you experience any unusual symptom, you should seek out for medical intervention as early as possible. So those are some of the symptoms.
Thank you. Thank you, Dr. Ali. So attendees, we're seeing your questions. Just be a bit patient. Once we round up the session, the presentation, Dr. Ali will take those questions. Now, Dr. Ali, just to move a step further now, you just talked about how we can identify certain salient signs and symptoms. But now, are there preventive measures as individuals, male and female, that we can take to prevent or sort of delay hypertension?
Very nice, doctor. Those are the key points why we are here, take-home points. What do you and myself, every one of us, what do we have to do? What do we have to do? We've said that quite a number of things that we do, increases our risk of getting high blood pressure. So therefore, starting from what we eat, our diet. There's a slogan that talks about a dietary approach to stop hypertension. Dietary approach to stop hypertension, dietary approach to reduce, to reduce us developing hypertension, dietary approach to minimize or even postpone. It might come, but at least you can postpone, with what you eat and what you expose yourself to. And therefore, what you and I have to do is to be very conscious of what we do on a day-to-day basis, because it's a cumulative thing that tends to also lead to all these metabolic diseases. Cumulative, what you and I do on a daily basis, on second by second, minute by minute, hour by hour basis, on a daily basis. So watch what you eat. Watch the amount of salt you consume. Don't just pick up things in the supermarket and buy them because it's nicely. Just check the content. Check the content of what you are buying. All these things are very important. And then what do you eat? What do you put on your table to eat? The quantity, the quality, even the timing of what you are eating them. They're all very important. And then, of course, stop smoking. Smoking does not have anything to do with good health. Right from hypertension to diabetes, heart failure, heart attack, to cancer. Smoking should, of course, also, as we are talking about environmental factor, our exposure to pollutants, irritants in the air, we should try as much as possible find a way. I will say that even this face mask we are using now for this pandemic is kind of a good thing, but for how long are we going to be using face mask is what we don't know. By the time we begin to use face masks to prevent hypertension, but by and large, we're saying that we should be conscious of our environment, what we eat, what we drink. Alcohol consumption should be minimized. We don't need to drink the brewery today. We can as well, spread it out or share it. Those are all the things. Then less stress. Have your hours of sleep. Sleep is very crucial in the human body. That is when the blood vessels themselves, they gently undulate. That's the time of gentle undulation for blood vessels. The time the blood vessels, the cellular element of our organs become, they are well fed, and toxins are removed. So hours of sleep is very important. Have adequate sleep. And the exercises, every one of us must get into irregular exercises on a daily basis. Even if it is not daily, if it is 3 times in a week, 30 minutes a day, and for each section, it's good for you. Those are proactive things that we need to do. And of course, for we women, as you enter into menopause, you know that the estrogen, protective estrogen, is no longer there. Therefore, you will need to be more conscious of your very self or your health as you are in the menopausal, age range for women. And of course, if, for example, during pregnancy, you have been told you have hypertension induced in pregnancy, diabetes in pregnancy, then you know that you need to do more work on yourself. Obesity, no time for excess weight, carrying excess weight. Every one of us must come down to our ideal weight, maintain our ideal body mass index. So these are things that you and I can do. And of course, we begin to check ourselves. We have home checkers, what we call home monitoring devices. So we can home monitoring devices, buy them, get them off the shelf. Do it yourself in the morning, check your blood pressure, check your blood sugar. And all these are very crucial. And of course, most importantly, is the fact that even for engine of our car, we do servicing our cars. Therefore, service yourself with your doctor. Comprehensive annual health check. Checking your organs from the head to the toes is mandatory, even as young as the age of 20. Everyone needs to begin to do it. Don't leave it until you are saying you want to be middle-aged or to 40. Please, people should get into the habit of doing a comprehensive annual health check, and making sure they check themselves off. And if, for example, you've been told once that your blood pressure is elevated, take precise actions. Don't leave it that, no, I reject it. No, it's the grandfather that had it. It cannot be me. Take a decisive, action and make sure your blood pressure is controlled to targets as it should be.
Dr. Ali, thank you very much. I particularly like the way you talked about the environmental factors, talked about the tests that we should do, annual screening, what we need to stop doing, basically lifestyle modification, exercise, dietary control. Fantastic. One more question before we take the ones from the attendees. Now, we hear about hypertension, high blood pressure. Are there times you have low blood pressure? And are there any issues with this? As in, are there any complications? Is it fine or does it become problematic?
Low blood pressure, unlike high blood pressure, is always symptomatic. There is always a symptom with low blood pressure. Low blood pressure is more and even far more dangerous than elevated blood pressure, because low blood pressure is a state of acute emergency if really there is a low blood pressure, and it's always symptomatic. I've seen some of my patients coming, Dr. Ali, my pressure in today is 90/60, and therefore I have stopped my medication because I obtained 90/60, and I ask him or her, do you feel dizzy? Do you have any symptoms? No, I've been going about my normal duties. It's 90/60. I even get 90/65 sometimes, and I'm saying, no, that is not low blood pressure. It's because your blood pressure is well controlled to target. So continue your medication. Therefore, low blood pressure is an acute emergency. It's an emergency state. It's always symptomatic, and it's something we cardiologists do not like to persist for long, because it means that the tissue they will not get their nutrition and oxygen supply as it's supposed to be, and it can lead to many things. It can lead to stroke, can lead to heart attack, it can lead to kidney failure. So low blood pressure, my brother, is not what we like to see. It's symptomatic, and it's very bad.
I thank you so much, Dr. Ali. It's been very informative. Okay, so now I think I'll go to the questions from some of our attendees. A good one is here. Any pointers? How do we manage high blood pressure and work pressure together? That would be more high blood pressure and stress. I don't know if you had any pointers.
Okay, any pointers from stress and then high blood pressure? A state of stress is a state of confusion. When an individual is stressed up, maybe whatever is stressing the individual, physical stress, mental stress, marital stress, so many, or financial stress, a state of stress by any reason is a state of confusion. And at that point, the individual will you will not be able to take care of what you are supposed to take care of with regards to your health. In fact, your health will be the last thing you think of. You eat anything. People under stress, they will smoke, they will drink heavily, they will not even be able to sleep normal hours of sleep. Sleep will elude them. So really, and as we have said earlier, all these are already risk factors, more risk factors for development of high blood pressure. And if the state of stress continuously becomes chronic, it's a matter of time before what we call neurohormonal, the hormonal system of the body become chronically elevated, what we call sympathetic system chronically elevated. And you and I know blood pressure is a product of blood volume and vascular constriction. So with time, the individual will become hypertensive. It's a matter of time.
Okay, all right. Thank you for that, Dr. Ali. Another question. This is a very clinical question, I guess. From Mr. One of our attendees. Now it goes, I am a 49-year-old male and I occasionally experience palpitations. He feels heaviness in his left chest region. He gets tired easily and is also breathless. At times, easy fatigability, and he gets dizzy. What would you advise him?
49-year-old, he shouldn't even be, he should be in the hospital by now. so that the specialists can, the doctors can work him up and find out why all this is. These are all very important symptoms that is exhibiting. First is a male, two is age, so it has both the non-modifiable and even the modifiable risk factors, especially his age. Is a male, he's 49, he's a black, he's a Nigerian, and then he has all these symptoms. So he needs to quickly report himself to the hospital so that they can evaluate his cardiac function, the vascular function, and then see how intervention can be done and the management instituted as early as possible.
Okay, all right. Thank you for that. So our viewer, if you just listen to Dr. Ali, please present yourself at a hospital. Another question which I particularly like this question. Good day, doctor. I recently lost an in-law who was pregnant but had high blood pressure. I know what it is, but I think I'll let you answer it. Please, can you explain the dangers pregnant women are exposed to as regards hypertension, high blood pressure, that is?
That's a very, very important question from this viewer. Very important. Hypertension, in pregnancy, is a dire emergency, and even here we recently had a case also, and that is why I always say that pregnancy is almost like a disease state. If your blood pressure become elevated during pregnancy, then it should be a joint venture, a joint management by the obstetrician and the internist, such that the blood pressure of the pregnant woman is well controlled right from outset, and usually what happens is that such women possibly they already have the undertone of elevated blood pressure, and they were not looking after themselves, and pregnancy is a state of stress, increased blood volume, all the hormones that are circulating, they are all hypertension prone hormones, so therefore with pregnancy, hypertension is can be very, very difficult to treat, and it's always good that individuals who are pregnant, who have high blood pressure, they must make sure they treat them early enough and maintain normal blood pressure throughout pregnancy and even up to 6 weeks after delivery. And the complication is large. They can go, even during delivery, they can go into heart failure, and that heart failure is what is going to result in atony, uterine atony, and the bleeding from there, and all kind of things can occur. The HELP syndrome that the height of it, liver failure, and so on and so forth. So it's not something to take lightly. It's something that needs to be well managed in appropriate center.
Thanks. Yes, thank you, Dr. Ali. So just to reemphasize preventive measures, everything you've talked about. Okay, let's just all ensure that we have our blood pressures checked regularly. Another question I have here is, I am hypertensive and on drugs. Does this have any effect on sexual performance at all?
Yes, unfortunately, this is what we call a causal effect, and a causal and like a circumferential effect. Hypertension can cause loss of libido, impotence, and even the treatment can also even worsen or even cause the loss of libido or impotence. So, but we have many medications available on the shelf for management of blood pressure. Some of them are really bad. They can actually make a man almost totally impotent. While some of them they are gentle. They are gentle on male sexual organ, and we tend to go for that more. Vis-a-vis the father, we don't want any marital disharmony while we're being while the patient is being treated. I always say that I always like my patient to look forward to the next day to take their medication. So therefore, the medications must be something that is heavily they can tolerate, and with minimal side effect. So therefore, we profile the individual and we give them medications that that is good for their system. So I believe possibly he will just need a review of his medications, whereby we give medications that are gentle, that do not cause, do not aggravate the impotence or loss of libido. So he will need to review a review of his medications, such that we give him one that is good and can tolerate and can look forward to taking it without loss of libido.
Fantastic. Thank you very much for that. So another question here is also a clinical one. 29-year-old complaining of a sharp pain directly around the heart region. At times, breathing in deeply is difficult. What would your advice be?
Well, 29-year-old with what we call pleuritic chest pain, and that is now, as we need to check the lungs to make sure that he does not have any pathology in his pleural, in the space surrounding the lung, the pleural space. Oftentimes, when you get a patient complaining of breathing and then chest pain that is made worse by breathing deep, then you know that we need to exclude disease in the lungs, and the pleural space. Of course, they can coexist together with the heart condition. So therefore, you just have to, submit himself for proper evaluation and institution of proper treatment.
Okay, all right. Thank you, Dr. Ali. The questions are just coming in, so I'm sorry, I'm just trying to filter some of them. So another interesting one is one of our people asked, can teenagers from say 14 years develop hypertension?
Yes, of course. Yeah, teenagers from 14 years can develop hypertension. Mind you, in medicals, adults is from age of 12. Pediatrics end at 11 years, 11 months. Right? In clinical setting, an adult is age 12 and above. So age 14 is already an adult and definitely can suffer hypertension. But hypertension in this much younger age group tends to be more like secondary hypertension. So we need to exclude underlying problems, chronic kidney disease, some adrenal, dysfunction, some, congenital problems that have with them high blood pressure in addition.
Okay, all right, thank you for that. Dr. Ali, we have a lot of clinical questions. Another one coming in says, I just visited the hospital today after being restless and sleepless for 3 days. My blood pressure was 138/88. The hospital said I am fine and only gave me medication to help with sleep. I am afraid of the high blood pressure. What should I do? I still feel lightheaded.
Of course, the blood pressure is not fine. As we have defined here today, his blood pressure is 138/98. Obviously, is not fine. And this is what we are talking about what we call KPI, knowledge, attitude, and perception. And the knowledge is both for the patient and for the doctors, the general practitioners. I was once asked to come and give a talk to a general practitioner group some few years back about what is the perception about high blood pressure, management of high blood pressure, and so. And I first asked them, do you even know that there are guidelines? And it's like, guidelines? No. We have even Nigerian national guidelines for management of hypertension, diagnosis and management. Majority of our medical practitioners are not even aware of this. Top members of the Joint National Commission, of 8 or 9 or 7, 8 or 9, they are not even aware of all these guidelines in the diagnosis and management of high blood pressure. So there's a knowledge gap. There's a knowledge gap. So definitely, blood pressure systolic of 138, diastolic of 98 is not well controlled. And this is what we see, whereby we say that 50% of people, majority of people who have high blood pressure, they don't even know they have it. Of those who know that they have the high blood pressure and they are treatment, 50% are not, treated to target. Of those who are treated to target, or of those who are on treatment, 50% are not treated. They are not obtaining the target blood pressure management. They are just on treatment. It's not as if they are not on treatment. They are on treatment, but it's not to target. Optimal blood pressure must be reached for us to reduce end organ damage, complications, and sudden death. We must aim at getting the blood pressure controlled to targets. It is very important. So 138/98 is not optimal blood pressure. The clinicians need to do further. They need to evaluate him. They need to help him. It could be that they will tell him, just stop taking salt. You understand? They can just tell him, stop salt intake for now. And that will help his blood pressure to come down, even without any further adding further medications. So therefore, the patient has to be treated to target, to relieve the heart of the pressure in the blood vessels. Therefore, the patient has to be properly evaluated to help him or her.
All right, thank you, Dr. Ali. I think this your last answer actually is that it's not just to patients but the doctors as well. We all need to be aware of the current trend, what the treatment protocol is now. Okay. All right, thank you for this. Yes. Okay, so another question here says, is it possible for hypertension to stop without requiring drugs after substantial weight loss? Well,
what I can say is that weight shedding helps in the management of high blood pressure, in the fact that at a point in time, if, for example, an individual that is obese, comes down to normal weight or the ideal weight or ideal BMI, it will help in the control of blood pressure. Possibly the individual is taking a blood pressure medication, maybe two doses a day, and it could be reduced down to like 1 a day. But quite far in between, I once had a patient, it's an elderly man who was a banker, who was an executive in one of the banks, in a commercial bank. I know how stressful it was. So he eventually obtained his retirement, and after monitoring him for a while, we noticed that, look, even with the smallest dose of blood pressure medication, his blood pressure, was no longer becoming high. So we gently, remove the pressure medication totally, and then watching. So we can have some cases whereby far in between, whereby we may watch the individual. Okay, stop this medication, and then let's watch you. Make sure you check your pressure. Make sure you keep an eye on the pressure, so that anytime it rises up, then it means that we need to reintroduce the drug again. So there are windows for that. There are windows for that.
Okay, all right. Thank you for that. Thank you so much. So another question here, Dr. Ali. I'm sure everybody's enjoying this as much as I am, because I'm also learning about the way people see hypertension. How they just view it from these questions. So Dr. Ali, the question goes: I currently take 5 milligram amlodipine on a daily basis. Often my blood pressure hovers around 96/67. Please, at what point do I temporarily discontinue drug intake?
96/67. Now, I will also say at this junction that medication issued for blood pressure is not only numbers. It's not only for numbers alone. We also give medications to protect the organs, what we call protective effect of these medications on the organs, on the brain, the heart, and the kidneys. So sometimes you need to treat beyond the numbers. But blood pressure of 97/67 does not say the patient or the individual should stop medication. No, we might, at the end of the day, evaluate the patient, and if the patient has, for example, left ventricular hypertrophy, or some form of other end organ damage, then we may just need to move from amlodipine and give the individual what we call ARB or ACE inhibitor, whichever one of them he or she can tolerate. So therefore, if you have a blood pressure of 97/67 on 5 milligram of amlodipine, come in and for evaluation, we might just need to change you from calcium blocker to ACE inhibitor or ARB, some other drugs that are more gentler but are more protective. In essence, what I'm saying is that management of high blood pressure is not only in the numbers, not the figures alone, but also goes to protect the end organs, the heart, the kidneys, the brain, from suffering complications.
All right, thank you for that. I think a lot of people are actually interested in stress. What you mentioned about stress. I have a couple of questions on stress. Now, I'm not sure this is directly at you, but I think you can at least take a look at it. There are a lot of stress points we experience in Nigeria. Doctor, please, what can you advise employers of labor to do to ease work stress, at least from the health point of view?
Yeah, I quite understand what the individual is saying. I quite understand that. There's a lot of stress, especially in big cities and more so in Lagos, whereby the traffic, having to wake up very early in the morning, hit the road by 5, and even before you come back, to the house, you are in the traffic. You get back home at 11 p.m. Sleeping at 1 a.m. You are awake again at 4 a.m. It is quite horrendous stress in big cities, especially Lagos. What I always advise my patients to do is that this is the time to take care of your health more. This is the time to do the needful with regards to your health, to be conscious more about your health. What is it that something that you don't feel today, you are now beginning to have the symptom symptom you don't have before. You've developed the symptom of slight headache or some tiredness or fatigue. It's a time for you to be proactive, to look after your health. I always tell them that sometimes if it is not every day that you excuse yourself from duty, you can take an excuse from duty and tell your boss you want to go and check up your health in the hospital. You develop a symptom. So please, at a point in time, let us halt. Let us halt what we are doing. Let us put everything aside and say, okay, I need to go and check up my health in the hospital. So those are things that I used to tell them. And again, I used to say that if, for example, you have been chronically exposed to not sleeping, Monday you didn't sleep well, Tuesday night you didn't sleep well, by Wednesday night, you can say, please, I need to just get to bed and then sleep early and then wake up a bit late, kind of walking around it, as we must walk and then we must also take care of our health. So it's a time for each and every one of us, even with this pandemic, what has happened in the recent worldwide, this Corona-19 pandemic, whereby so many people do not even know they have diabetes, they have hypertension until the COVID-19 virus, struck them. So therefore, it's telling everyone you need to be more proactive. You need to be conscious about health. It's not all about I'm going to work, I'm going to work, I'm coming to work, I'm going to work. And as we said earlier, the absence of symptoms does not mean all is well in your health. So it's a time because of the lot of stress on ground, it's a time to be more conscious of our health, for you and I to do more conscious effort, to put more conscious effort, to put more proactive, actions into our health issues. The fact that no symptom does not mean all is well. We need to always look out for and intervene before it is too late. So we need to work, we need to go out we need to make money, but again, we need a healthy body to make the money, to do the job effectively well. So it's just a time that every one of us, we have to be more conscious, be proactive about our health issue, and just not leave ourselves alone until there is a problem. So that's what I would advise negotiants. Yeah.
Okay, all right. I'm sure we all that was very good. Thank you. But Dr. Ali, a couple of more questions. I'm almost through. Our time is almost up, but this is quite important. I think you mentioned the side effects of a blood pressure medication affecting males. The question here says, any of these drugs, do they actually affect females? And let me add, okay, all right.
Yes, it does. They do affect female libido as well. They affect female libido, but because females usually don't complain. I don't know why. Females usually don't complain. It's usually men that you see complaining. But I can tell you that the antihypertensives, especially those who have effect on libido, they also affect women. Yeah, they also affect the women libido. Very, very.
All right. Okay, all right. Thank you. The last question now. How often should a millennial go for health check in a year? And also, the follow-up, an elderly person about 66 years old, how often should he or she go for a health check as well?
Well, commonly, it's supposed to be once a year. I mean, annual health check is supposed to be once every 12 months. Albeit, if, for example, individual is on, medication, for monitoring by specialists or by the doctor, you need to keep your follow-up appointment. Follow-up appointment is different from annual health check. Follow-up appointment, you must follow up your appointment if you're on medication, so that the doctor will know whether the drug you are taking is sufficient or not. I have once, if just yesterday, somebody said he's been taking his drug for the past 3 or 4 years without seeing a doctor, and suddenly developed signs and symptoms of hyperuricemia, gouty arthritis. But if he had been following up with his doctor, the doctor will have noticed the uric acid has gotten to a dangerous level, and now he has swelling, all over, at points all over his body. So if you're on medication, please go for your routine follow-up visits, which usually can be once a month, can be once in 3 months, can be once in 6 months, depending on individualized management. Albeit, if, for example, you don't have any health challenge, you are not hypertensive, you don't have diabetes, you can have a once a yearly annual health check. Even apart from the routine follow-up, individuals should still have annual yearly health assessment. So that's the way it should go. Follow-up visit one side, assessment another side.
Okay, all right, Dr. Ali, thank you so much. I know you took time out of your busy schedule to be with us here today for this session. But before we round up, I'd just like to apologize to our audience. I'm sorry, we are pressed for time, so we can't take a lot of the questions. However, you can actually post these questions on our social media handles at Avon HMO on Instagram, Twitter, Facebook. In addition, this video will be available on our YouTube channel. Just type in Avon HMO in the search box and it will pop up. Okay. So Dr. Ali, a very, very big thank you. I look forward to having you here again. and having a very productive and educative session like this.
Thank you. Thank you, Dr. Adewale. Thank you for having me on your show. I love to join you again.
All right, thank you.
1 p.m.